Hey guys, Dr. Heather Moore here, owner of Total Performance Physical Therapy. I want to take you through a quick tutorial on why your shoulder hurts, what you can do about it to avoid medications, injections, and surgeries from the comfort of your own home. Some of you may have already been to the doctor. Some of you might not have gone there yet. Some of you might have had an MRI or an X-ray and nothing shows up, maybe just a little inflammation. But you notice that you can't do the same activities that you can do, or you used to be able to do. You can't lift overhead, so you use the other arm, but you're able to get by. And as time goes on, your body begins to self-limit more and more. And what I mean by that is it begins to not have you reach overhead at all, or maybe not as high, or maybe you could lift a gallon of milk before, but you can't lift it now. Maybe you could sleep all the way through the night now, but now you have to wake up once and adjust because your shoulder is bothering you. You're noticing that things are starting to be limited with the shoulder. You took some Advil, maybe you did a little bit of ice, nothing seems to help. And you're frustrated because you didn't do anything. You didn't fall on your arm. You didn't have an accident. Nothing really that you can remember happened to your shoulder, but now all of a sudden you're not able to use it as much as you could, and here you are stuck with the pain. Shoulder pain starts out very slowly. It's almost not noticeable at first. So you can go through months without having any problems doing activities, and you'll just be sore one day, or it'll just bother you a little bit one day. But then all of a sudden that one day every few months becomes, okay, now you woke up with shoulder pain twice this month, or now you've noticed that you have problems lifting overhead, or now you've noticed that you go to the gym and aren't able to do everything that you could do. It's a snowball that slowly starts to build. As it gains more and more traction, you're going to notice less and less activities that you're able to do. So here's how it goes. And this is a bullseye that I created. I am not an artist, I am a physical therapist. But this is usually how the bullseye works. So on the outside we have running, exercise, lifting heavy. In the middle ring here we have standing, walking, lighter activities, reaching overhead. Here we have in the inner ring we have sleeping, sitting, and basics of living. On the outside we have running, exercise, and heavy lifting. This is the first circle that starts to go away when you begin to self-limit. So you're going to start to not lift as heavy. Maybe if your right shoulder is bothering you, you're going to do your lifting with your left shoulder. And slowly this ring starts to go away until you don't lift heavy at all with that shoulder. You don't exercise anymore with that shoulder because it bothers you too much. This circle can take months or weeks to go away. It doesn't have a prescribed time limit. So this could take a year, this could take a couple weeks, this could take a couple days. It depends on when you notice things start to be limited. Then we have this ring in here. This is when your activities that really start to impact your life on a daily basis start to be affected. Just reaching over your head to put a dish in the cabinet. Just a small weight reaching overhead. Sitting at your desk at work, your shoulder begins to throb. Trying to put on a bra, reaching into your back pocket for a wallet. This is when this circle starts to really disappear and these behaviors become limited. And then eventually it starts affecting the basics of life. Just being able to put on a shirt, put on a coat, go to sleep, just sit down. It becomes a pain all the time. There are no intermittent activities that it doesn't interfere with. It interferes with something every single day. What can you do about it? Well, you can choose to ignore it. You don't have to do anything with it. So you can discover that you have a pain in the shoulder. You can be alerted to it. You acknowledge that there's a pain, and you might not think it's anything. You may say, oh, I just did this. Oh, I just did that. And you may ignore it. But you don't admit there's a problem. So you wind up just ignoring it. You do nothing with it. You don't take any Advil. You just say it's going to go away. It's old age. It's this. It's going to get better on its own. The next thing you can do is alter it. This is where over-the-counter medications come into play. This is where over-the-counter drugs or even prescriptions that your doctor gives you come into play. So here you're going to admit that there is shoulder pain that's not going away, that you have to do something. You're not quite sure what to do, but because now you're starting to limit some things, and these things may be in that outer ring that we talked about, and maybe more in the middle ring, or it could be all the way in the center ring. But you recognize something needs to be done, and maybe you want a quick fix, and you go to the doctor, or you go and you start taking some ibuprofen that's over the counter, or you get an injection, any quick fix on the market just to stop the pain, and you altered it. It stopped. The shoulder doesn't hurt anymore. You didn't fix the problem. You didn't address anything. You didn't fix why it actually hurts, but you did stop the pain. Now, why do you stop the pain after altering it if you didn't fix the problem? A lot of times there's just inflammation in your shoulder, and if you calm the inflammation down, which is taking a drug, a shot, you will decrease some of the pain. Now, many times, most of the shoulder pain that we treat here is because people don't know how they got it. They don't know what happened. They didn't have a traumatic injury. So this inflammation had to come from somewhere. So if you give yourself a shot or you take the pills and the inflammation calms down, you didn't fix why you had inflammation. You calm the inflammation down, and now all of a sudden, it's back again. Some of you listening may even had the 3 cortisone shots, or, gone through that cycle where the first one worked great, but by the second and third, there was nothing. It didn't help at all. So this is, altering it means that you're just delaying the inevitable. You can compensate for it. This is probably one of the most popular things that people do, and it's because your shoulder begins to hurt. You are completely aware, but you need to do things. So you're going to take some Advil, and you're going to continue with your activities. You can't limit anything because, let's face it, you have to go to work and you have to sit at your desk, or you have to lift your children, you have to reach overhead. So you take some Advil and you begin to compensate. And you begin a compensation pattern that you are unaware of. Your body compensates without you knowing it. So you're going to change how you lift your arm overhead. Maybe you rotate it a little more. Maybe you don't reach exactly out to the side. Maybe you slouch your shoulders down and then reach up. Whatever the case may be, you start compensation because you're still going to do the activities. You still want to be able to reach overhead. You still want to be able to sleep. You still want to be able to put your bra on or put your wallet in your back pocket. You still want to be able to get dressed. So you start to change how you use your shoulder. The body will do this subconsciously at first, and then it will involve the conscious mind. So when it first starts to feel pain and you maybe take an anti-inflammatory, maybe even not, it'll start to use your shoulder a little bit differently. And it'll start to use muscles a little bit differently because it wants you to be able to do everything that you want to do. It wants you to be able to move your shoulder. It wants you to be able to lift overhead. So your body will do this subconsciously. As it progresses, though, you're going to start to notice that the muscles are sore and you're going to have pain when you lift, and you're going to not be able to alleviate that pain. The muscles that are recruited to compensate eventually grow tired. They're not designed to work the way the shoulder wants them to work currently, so they will get tired. This is when the snowball really starts to increase speed and really builds up steam. The compensation pattern begins to snowball and it begins to fail. And your body can no longer recruit any new muscles to help it out. It is just tired and done. So it is going to begin to ache, throb, hurt all the time. The final thing you can do with shoulder pain is you can just handle it. And unfortunately, this doesn't come a lot of times until people are really in that snowball, really, down in the inner circle where this is really affecting sitting and just, the core bit of sleep that they're able to get. When you choose to handle it, you're addressing the problem. You're going to find out exactly what's going on and why you have the shoulder pain, more than, oh, it's inflammation. Well, if it's inflammation, there's a reason. So you're going to get the reason that the shoulder is having pain. We're going to show you some specific tests to diagnose the problem, and we're going to show you targeted specific exercises so you can have a pain-free shoulder. So what are these? What are some of the special tests that you can do in the comfort of your own home to see what is going on with your shoulder? So the first one is you're going to sit up with your back nice and straight. You're going to place your hand behind your back like you're reaching into your back pocket. What you want to do is you want to have the back of your hand up against your low back and your palm facing out. You want to try and lift your hand away from your lower back. Now, if you are unable to do this, this is an indication of a problem. If you're able to do this, you want to try and have somebody gently try to push your hand back onto your back. If you're able to sit up straight and resist them, then this is not a positive special test. If you have to slouch over in order to be able to push back, that's a positive special test. And if you can't hold it at all as they push against you, that is also a positive special test. So what does a positive special test mean? So a positive test, again, is if you were not able to lift your arm away from your back, or if someone applied pressure to your hand that you were not able to hold it. So what if you can't lift your arm off your back, or when someone pushes against you, you can't hold it? Perform the sleeper stretch. So a positive test is indicative of a tight muscle in your rotator cuff. So what we're going to do is we're going to perform the sleeper stretch. So you're going to lay on your side with the injured side or the tight side down. So you're laying on that shoulder, and you're going to slowly and gently apply pressure downward. Eventually, you want your hand to touch the mat. So you want that finger right there to touch that mat. Now, as you can see, I have a very tight shoulder. You don't want this to be painful, so you're not going to jam this as far down as the mat. If that's all the further it goes, you want to hold that there for 30 seconds, and you want to do 6 sets of these. And you want to just gradually have that go lower and lower each day. This should not be painful. So if it is, you want to back off the stretch a little bit. Now, would you like to show you even more tests that you can do for your shoulder and exercises to correct them for free? I'd be delighted to. If you want to discover the cause and diagnosis of your shoulder pain, discover even more special tests to be able to determine exactly the cause of your shoulder pain, and see at-home solutions like the ones I showed you to treat the exact cause of your shoulder pain, if all that sounds good, then here's what to do next. You're going to click the link in this post or the button in this video, and you'll be taken to a simple registration page where you can sign up to receive a free shoulder pain solutions book. It's completely free, no strings attached, and you will be able to see some more of what I've just shown you. I hope you've enjoyed this video as much as I have enjoyed making it for you. I really look forward to you reading the book. Now go ahead and sign up to receive your free copy.